For most of human history, disease arrived without warning and without explanation. People fell ill suddenly. Entire households disappeared within days. Cities emptied. No one knew why. Before bacteria, before viruses, before microscopes, disease was understood through superstition, divine punishment, or bad air. And yet, long before modern medicine existed, humans noticed something unsettling. When the sick were separated, fewer people died. This observation did not come from science. It came from fear, survival, and pattern recognition. In the ancient world, isolation was instinctive but inconsistent. The sick was sometimes expelled, sometimes hidden, sometimes abandoned. There was no system, no timeline, no rule. That changed in the Middle Ages, not because people understood disease, but because trade forced them to confront it. In the 14th century, Europe was connected by sea. Ships moved spices, silk, grain, and something else: the Black Death. When plague reached port cities, death followed trade routes with terrifying precision. Venice, a commercial hub, faced a choice: protect commerce or protect life. Their solution was radical for its time. Ships arriving from plague-affected regions were required to wait offshore before unloading. At first, the waiting period was 30 days. It was later extended to 40. In Italian, 40 giorni, quarantine. No one knew about bacteria. No one understood incubation periods. But 40 days worked. Not perfectly, but noticeably. Plague outbreaks slowed. Some never reached the city at all. Isolation became policy. By the 15th century, quarantine stations, known as lazzarettos, were built on islands outside major ports. The sick were isolated. The possibly sick were observed. The healthy waited. It was crude, it was harsh, and it was one of the most effective public health interventions ever devised, centuries before modern medicine. Quarantine succeeded not because people understood disease, but because disease follows time. Most infectious illnesses have incubation periods. Symptoms appear after days, sometimes weeks. By forcing separation, communities unknowingly disrupted transmission chains. They gave disease time to reveal itself. Even without microscopes, the logic held. Cities that enforced quarantine experienced fewer secondary outbreaks. Ports that ignored it suffered repeated waves. This practice spread across Europe, the Ottoman Empire, and later the Americas. It became embedded in maritime law. Quarantine was not humane by modern standards. People died alone. Families were separated. But it reshaped survival. For centuries, quarantine remained one of the few tools humans had against invisible threats. And then, medicine advanced. Germs were discovered. Vaccines developed. Hospitals modernized. Isolation became less visible, until the world forgot why it existed. As medicine progressed, quarantine faded from daily awareness. It became associated with extreme outbreaks, something historical, something rare. When it returned in modern times, it felt sudden, foreign, unreasonable. The practice had not changed, but public trust had. Quarantine works best when understood. It fails when imposed without context. The medieval world obeyed quarantine because survival depended on it. The modern world questions it because memory is short. Quarantine is not a symbol of fear. It is a record of observation, written long before science could explain it. In the human ledger, it stands as proof of something important, that long before we knew why something worked, we were already living with the consequences of ignoring it. If you want to understand the ideas that quietly shaped human health, and you found value in this, like and subscribe for more. This has been The Human Ledger. See you in the next entry.